Good morning, good afternoon, and good evening. My name is Hafiz Mukhtar Jahun. You are welcome to Weekly Healthy Tips, and today's topic is asthma. We are going to discuss about asthma, and asthma is a broad topic, so I divided the lecture into two parts. The first part will consist of definition, symptoms, causes and risk factors, pathophysiology. So these are the part 1. What is asthma? Asthma is a chronic lung disease and a very common respiratory condition. It is also known as reactive airway disease, which is inconvenient most of the time but manageable. People with asthma have high sensitive airways, that is the tubes that carry air in and out of the lungs get tightened and swell off and makes too much mucus. What is mucus? The mucus is that slimy stuff that keeps our airway moist. So when this mucus accumulates in the airways, it makes the breath to be hard, the breathe in and breathe out, due to the narrowing of the airways. And according to the Global Burden of Disease Study, GBD, the most recent revised global estimate of asthma suggests that as many as 334 million people worldwide have been diagnosed with the condition, and the majority of people affected are in low and middle income countries, and its prevalence is estimated to be increasing in those countries. What are the common symptoms of asthma? The common symptoms of asthma can be difficulty in breathing, that is, patient will have difficulty while breathing or breathe out, wheezing, that with the sound while during breathing, tiredness, you easily get tired, maybe due to work or sedentary, chest tightness, coughing, and difficulty in speaking. Sometimes people with asthma find it difficult to speak. What are the causes and the risk factors associated with asthma? Asthma has many causes. The exact mechanisms of onset of asthma is still unknown, that is idiopathic. Why? This is due to asthma not being a single disease, but a variety of multiple diseases with similar clinical features, resulting from different genetic and environmental causes. It may develop at an early age. The complex interplay between the hereditary and the environmental factors which are occurring at this critical time in developing lead to the onset of this disease. The risk factors associated with developing asthma are hereditary, that is family history. When someone in your family has an history of asthma, the probability of you getting the asthma also is high. And the susceptibility to allergic reactions, if you have susceptibility to any allergic reactions, so it might also predispose to asthma. environmental factors, tobacco smoking or passive smoking. Passive smoking also predisposed to asthma. If someone is smoking, you should leave the place where he's smoking so that you can avoid yourself from asthma attack. Prenatal smoking in those mothers whom they have habit of smoking. Dust, living in a dust area. Carpet, all those soft carpets that they retain dust or retain some substances that can predispose to asthma. Fat hair. Yeah, of course, people have the habit of touching their feet randomly without even maybe taking care of their health. So touching pet hair without washing hand can lead to, you can touch one viral substances or bacterial substances on the feet, and if care is not taken, it might predispose to asthmatic attack. Pollens, pollutant, chemical exposure, and urbanization. Other causes of asthma can be due to low birth weight, early age antibiotic use, that is, you should early age use of antibiotic, viral infection, and diet. Asthma can be triggered by one of the following: strenuous exercise. You should monitor the way you exercise yourself. Cold air, climate change, emotions, medications such as aspirin, beta blockers, and NSAIDs. Respiratory infection, irritant inhalation, stress, allergic reactions. All of the above that I mentioned are factors that can trigger the attack of asthma. Pathophysiology of asthma, that is how the asthma develops. Of course, in asthma, airway constriction is caused by combination of two things. Number one is bronchial constriction and bronchial inflammation. So these two factors combine together and lead to chronic lung pathology, in which the bronchial airways are prone to narrowing. Then when they cause the narrowing, there is an episode of maybe wheezing, chest tightness, coughing, shortness of breath, which might be mild in severity or moderate or high, and it can be up to life-threatening. How does this happen? So when the allergens enter through, when the allergies, I would say, not allergen, I mean, enters airways through either oral or nasal cavity, it results in swelling of an already compromised and highly sensitive airway, which result in constriction of that smooth muscle of the airways and excessive release of that mucus, which blocks the passage of the airways, of the airs through the airways. As a result, person with asthma or patient with asthma will have difficulty in breathing, sometimes difficulty in speaking, cough, wheezing, and chest tightness. There is due to difference of air flow rate, the lungs become also hyperinflated. When the tidal volume of the lungs reach the capacity of that dead space, it is termed alveolar hypoventilation and result in ventilation perfusion mismatch. And this mismatch is ultimately worsened by vasoconstriction. So this briefly comes to the end of the Part 1 lecture. Part 2 will be in the next session, and it will consist of the types of the asthma, the clinical features of the asthma, the prevention of the risk factors that can cause asthma, the management to include drug, diet, and the physical therapy management. See you next, and don't forget to subscribe if you didn't subscribe to my channel. Give thumbs up and share the videos. And if you have any suggestion or any compliment, you should mention it below. Thank you, and that will really help